she asks, embarrassed, if she can sit with the colonel and his 3-year-old twins, the missing leg heavier than the silence around her. Before anyone can answer, one of the toddlers points at her and says 3 words that freeze the whole table. No one imagines this ordinary nurse buried a war she can't outrun, and it's about to surface, spoken by a 3-year-old. Like this video, comment where you're watching from, and subscribe. Welcome to the Navy SEAL Nurse Stories. Sarah Kessler kept her eyes on the floor tiles, 32 steps from the nurse's station to the cafeteria. She counted them every day. The prosthetic below her right knee never made noise anymore. 4 years of practice did that. You're late again. Dr. Preston Vale didn't look up from his tablet. Some of us have book signings to prepare for. I was with a patient. Sarah kept her voice flat. Everyone is always with a patient. Vale finally glanced at her. Try being efficient instead of invisible. She didn't answer. Answering never helped. The VA hospital cafeteria smelled like coffee and antiseptic. Sarah carried her tray toward the corner table she always used, the one nobody else wanted. A man in marine dress blues sat 2 tables over, a toddler on each side of him. He looked exhausted in the specific way parents of twins looked exhausted. Sarah recognized the rank insignia. Colonel. She recognized something else too, something she couldn't name yet, a shape in her chest like a held breath. She didn't look at his face. She never looked at faces like that one. Papa Potty, the little girl announced. The colonel stood, scooped up his daughter, and turned to his son. Jonah, stay right there. Don't move, buddy. The boy nodded solemnly and stared at his shoes. Sarah watched the colonel disappear down the hallway with his daughter. The boy sat alone, 3 years old, swinging his legs under a chair too tall for him. She should have kept walking. She always kept walking. Instead, she stopped at his table. Is this seat taken? The boy looked up. His eyes were the same gray-green as his father's. You can sit, Jonah said. Are you a doctor? Nurse. Sarah lowered herself carefully, the prosthetic catching for half a second on the chair leg. It always did that in the cold. Jonah's eyes went straight to her leg. Not with pity, with the blunt curiosity only a toddler could manage. Where's your other one? I left it somewhere far away, Sarah said. It was the answer she gave everyone. It was also, technically, true. Jonah accepted this without further questions. 3-year-olds rarely needed elaboration. Sarah unwrapped her sandwich. Her hands were steady. They were always steady in public. The trembling came later, alone, in the supply closet with a door locked. Vale's voice carried from across the cafeteria, loud enough for effect. That's Nurse Kessler. Sweet girl. Not much upstairs, but she's very good with bedpans. A few staff members laughed. Sarah's jaw tightened, but her face stayed still. She had trained her face to stay still through worse than that. Jonah frowned at the sound of laughter he didn't understand. He studied Sarah's face like he was solving a puzzle. Then his father returned, daughter on his hip, and stopped short at the sight of the empty chair now occupied. I hope he wasn't any trouble, the colonel said. No trouble. Sarah started to rise. You don't have to go. He set his daughter down and pulled out the chair beside his son. I'm Marcus Doyle. This is Mia. You already met Jonah, apparently. Sarah hesitated. Something in his voice, in the particular cadence of it, snagged on a memory she'd spent 4 years trying to sand smooth. Sarah, she said. Just Sarah. She never gave her last name in the hospital. Old habit, old rule. Mia climbed into her father's lap and immediately reached for the salt packets, arranging them into a neat row. Doyle gently redirected her hands. They're twins, Sarah said, mostly to fill the silence. Miracle of modern medicine and my wife's patience. Doyle smiled, but it didn't reach all the way up. She passed 18 months ago. Car accident. It's just the 3 of us now. I'm sorry, Sarah said, and meant it. We're managing. He looked down at his coffee. Some days better than others. Jonah tugged Sarah's sleeve. Do you have a picture? A picture of what, buddy? Doyle asked. Jonah shrugged, already losing interest. reaching instead for his sister's abandoned salt packets. Sarah felt the shape in her chest again, sharper now. She glanced at Doyle's left forearm where his sleeve had ridden up. A scar, pale and long, ran from wrist to elbow. She knew that scar. She had made that scar, or rather the surgeon had, cutting away burned tissue while she held pressure on a wound that shouldn't have let him live another 10 minutes. 4 years ago. A compound outside a city she wasn't allowed to name in casual conversation. A device buried under rubble that wasn't supposed to detonate for another 90 seconds. It had detonated in 11. "You okay?" Doyle asked. "You went somewhere just now?" "Long shift," Sarah said. "Sorry." Across the cafeteria, a maintenance worker in a gray jumpsuit wheeled a supply cart past the vending machines, moving slower than the job required, eyes tracking tables instead of the floor. Sarah noticed. She always noticed things like that. It was the one part of her old life she'd never been able to switch off. The man's gaze passed over her once, then snapped back and held. Sarah looked away first. Her pulse didn't change. 4 years of practice did that too. "I should get back to my rounds," she said, standing. "Maybe we'll see you around," Doyle said. "We're here every Thursday. Jonah's got physical therapy for a hip thing, nothing serious." "Bye, leg lady," Mia offered cheerfully. Sarah almost smiled. Almost. She walked back toward the nurse's station, 32 steps, and didn't look back at the maintenance cart, which had stopped moving entirely and was now parked outside the stairwell door marked Authorized Personnel Only. 3 days later, the alarm went off at 2:47 in the afternoon. A flat mechanical wail that meant something structural, not medical. Sarah was in the med room when the floor shifted under her feet. A low grinding shudder that rattled the pill bottles on the shelf. The stairwell door at the east end of the building had failed. Not collapsed exactly. Something had detonated inside the maintenance shaft, and the second floor above it had folded downward 6 inches, trapping a wing of the building under twisted rebar and concrete dust. Sarah's body reacted before her mind caught up. She was moving toward the noise while everyone else moved away from it. "Kessler, where are you going?" a charge nurse shouted. "We're supposed to evacuate to the north lot." "There are patients in physical therapy," Sarah called back. "That's directly under the shaft." Thursday, Jonah's appointment. She didn't remember deciding to run. She was simply running, past overturned carts, past a security guard yelling into a radio that wasn't getting a signal, toward a hallway now choked with gray dust and the particular acrid smell she recognized from another life. Not a gas leak, not faulty wiring. Explosive residue had a smell all its own, and her body had never forgotten it. The physical therapy room had partially collapsed. A support beam had come down at an angle, pinning debris across half the room. Voices were crying out under the wreckage, some clear, some already fading. Dr. Vale stood frozen in the doorway, tablet still in his hand, staring at the destruction like it was a television broadcast he couldn't turn off. "Call it in," Sarah said, shoving past him. "Structural collapse, multiple trapped. I need every trauma kit on this floor." "We should wait for the fire department," Vale said. "Standard protocol says..." "Standard protocol is for buildings that aren't actively settling." Sarah was already on her knees beside a chunk of drywall. "This is a load transfer situation. If we wait, the rest of that ceiling comes down." She found Doyle first, on his back, a support strut across his lower legs, conscious and cursing under his breath. Mia was crying somewhere out of sight, but audibly unhurt, her voice sharp and furious rather than pained. "Jonah," Doyle gasped. "Jonah's under the bench. I pushed him under the bench." Sarah followed the sound of a small whimper to a collapsed physical therapy bench. And there he was, curled in the narrow gap beneath it, dust in his hair, one arm pinned beneath a fallen weight rack. She didn't hesitate. She wedged her shoulder under the rack and heaved, feeling the strain shoot up through what remained of her right leg, through muscles that had spent 4 years learning to compensate. The rack shifted 8 inches. Enough. "Hi, buddy," she said, pulling Jonah free, checking his pupils, his pulse, his color. Fast heartbeat, no obvious deformity, minor abrasions. Scared, not critical. "You're okay," I've got you. My leg hurts, Jonah whimpered, pointing at his ankle, already swelling. I know. We're going to fix that. She set him gently beside a wall, out of the debris field, and turned back toward his father. Doyle's legs were pinned under enough weight that a straight pull could cause more damage than it prevented. Sarah recognized the pattern from a life she'd tried to leave behind. Crush injuries didn't forgive impatience. I need something to distribute the load before I move this, she said mostly to herself, scanning the wreckage. A metal cart, a section of pipe. She grabbed both, wedging the pipe under the strut as a lever, the cart frame as a fulcrum. You've done this before, Doyle said through gritted teeth. Something like it. Sarah threw her weight against the lever. The strut groaned and rose 2 inches. Just enough. Now, she said, and 2 orderlies who had finally arrived pulled Doyle clear. His right leg was a mess, likely fractured in 2 places, but the color was good. Capillary refill was good. Not an amputation. Not today. Vitals are stable, Sarah called out, falling into a rhythm she hadn't used out loud in years. I need 2 units of saline wide open, splint kit, and someone get this child's ankle immobilized before it swells past the joint. A young nurse blinked at her. Kessler, how do you know all this? Later, Sarah said, already moving to the next voice crying out from beneath the wreckage. By the time the fire department arrived 20 minutes later, Sarah had triaged 11 patients, stabilized 4 crush injuries, and packed a laceration that had been bleeding steadily since the initial impact. Her scrubs were gray with dust. Her hands, for the first time in 4 years, had not trembled once during the entire event. A paramedic crouched beside her as they loaded Doyle onto a backboard. Who did the initial stabilization on the leg fractures? This lever setup is textbook crush syndrome management. Field medicine, not hospital protocol. I did, Sarah said. The paramedic studied her for a moment too long. You military? I'm a nurse. She turned away before he could ask again. Vale reappeared once the worst of the danger had passed, tablet forgotten somewhere in the chaos, staring at Sarah with an expression that had shifted from disdain to something more calculating. That was. He seemed to be searching for a word that wouldn't cost him anything. Efficient. Sarah didn't answer. She was checking Jonah's ankle splint, murmuring reassurances to a boy who had gone quiet with shock now that the danger was over. You're going to be okay, she told him. Your dad's going to be okay too. I promise. You promise? Jonah asked, small and uncertain. I promise. Sarah had learned a long time ago never to make that promise unless she meant it. Mia, uninjured but shaken, refused to let go of Sarah's scrub top, fistfuls of cobalt fabric clenched in each small hand. As the EMTs wheeled Doyle toward the ambulance bay, he reached out and caught Sarah's wrist. Thank you. I don't know how you did that, but thank you. Just doing my job, Sarah said. That wasn't a nurse's job. His eyes held hers, gray-green and suddenly, terribly focused. That was a bomb tech's job. I've seen crush syndrome management like that exactly once before, in a debrief video I wasn't supposed to see. Sarah's blood went cold. You should get to the hospital. Your leg needs proper imaging. Wait. Doyle's grip tightened, not hard, but insistent. What unit did you serve with? I have other patients. Sarah pulled free and walked away before he could ask again, before the shape in her chest could climb any higher into her throat. She did not look back at the maintenance shaft, now sealed off with caution tape, where investigators would later find residue consistent with a small improvised device, professionally built, deliberately placed. She did not look back, because she already knew, with a certainty that made her stomach drop, exactly who had the skill to build something like that. Dorian Cassell had been caught 4 years ago because of her. Dorian Cassell had gone to federal prison because of her testimony. But Dorian Cassell had never worked alone. Elias Cray had vanished the same week as the trial. Nobody had ever found him. Sarah spent that night in the supply closet with the door locked, both hands pressed flat against the shelf, breathing through the tremor that finally, 4 hours late, caught up with her. The hospital reopened the East Wing under restricted access 2 days later, cordoned off from patients but crawling with federal investigators and windbreakers marked ATF. Sarah avoided that hallway entirely, until the day one of the investigators walked directly into the nurse's station and asked for her by name. Sarah Kessler? The woman was maybe 50, sharp-eyed, a badge clipped to her belt. I'm Agent Marisol Ruiz. I need a few minutes. I already gave a statement to hospital security. This isn't about the statement. Ruiz glanced around at the crowded station, then lowered her voice. This is about the device signature. It matches a build pattern we haven't seen in 4 years, not since Cassell. Sarah's face didn't change. I don't know what that means. I think you do. Ruiz studied her for a long moment. Your name came up in an old case file. Sealed testimony, 4 years back, Bureau of Alcohol, Tobacco, Firearms, and Explosives. Agent Sarah Kessler, bomb technician, Special Response Team. The room seemed to tilt slightly. That agent lost her leg in an operation that went bad. Ruiz continued quietly. Medical discharge, disappeared from the grid. I didn't think I'd find her working night shift in a VA cafeteria. You have the wrong person. I have your fingerprints from a coffee cup Dr. Vale conveniently handed me 20 minutes ago. Ruiz's expression softened slightly. I'm not here to expose you. I'm here because Elias Cray is loose. He's angry, and he just proved he can walk into a federal building undetected. Sarah closed her eyes briefly. 4 years of careful invisibility, unraveling in a hospital hallway that smelled like burnt coffee. Why now? She asked. Why here? Because you're the only living person who can identify his build style, and because Cassell's parole hearing is in 6 weeks. Ruiz's voice hardened. Cray isn't just angry. He's trying to intimidate the one witness who could put him away too. I'm not a witness. I'm a nurse. You were the best bomb tech ATF trained in a decade, according to your file. Then you saved a Marine colonel's life 2 weeks ago using field triage nobody teaches in nursing school. Ruiz leaned closer. That colonel is asking questions. He recognized your technique. It's only a matter of time before he puts it together too. Sarah thought of Doyle's grip on her wrist, the focused intensity in his gray-green eyes. She thought of Jonah's small voice asking if she had a picture. What do you need from me? She asked finally. I need you to look at something. Ruiz slid a folder across the counter, keeping it low, out of sight of passing staff. Security footage. Tell me if you recognize the man in the gray jumpsuit. Sarah didn't need to open the folder all the way. She had already seen that walk, that particular economy of movement 3 days ago, wheeling a supply cart too slowly past the vending machines. That's him, she said. That's Cray. You're sure? I trained myself to notice people like him for a living. Sarah closed the folder. He was watching the cafeteria. He was watching me. Ruiz nodded slowly. There's a program, off the books, that could use someone with your specific combination of skills. Trauma medicine and explosive ordnance disposal don't often live in the same person. I left that life behind for a reason. I know. I read the file. Ruiz's voice gentled, just slightly. But that life isn't finished with you. And there's a little boy down the hall who called you the leg lady and told his father you promised him he'd be okay. Cray knows that too. He was in this building. He saw what you did for that family. The words landed like a physical blow. You think he'll use them, Sarah said. I think a man who builds bombs to send messages understands exactly how effective a message gets when it's aimed at children. Sarah looked down at the folder, at the grainy image of a man she had spent 4 years trying to forget existed. Tell me what you need, she said. Doyle checked himself out of orthopedic recovery 2 days later, against medical advice, using a wheelchair and a wall of stubbornness to get to Sarah's floor. He found her in the break room, alone, staring at a cup of coffee she hadn't touched. You lied to me, he said, without preamble. You said you were just a nurse. Colonel, you should be resting. I called an old contact, ran a name that's been bothering me for 2 days. He wheeled closer. Special Agent Sarah Kessler, ATF Special Response Bomb Disposal, killed in action according to one outdated file. Medically discharged, according to the corrected one. Sarah set the coffee down carefully. You shouldn't have done that. You shouldn't have saved my life in a language only a handful of people on this planet actually speak fluently. His voice cracked slightly. You knew load transfer mechanics. You knew crush syndrome protocols that field medics learn in war zones, not nursing school. And you had a prosthetic leg that told me you'd paid for that knowledge somewhere I recognized. I paid for it 4 years ago, in a compound outside a city I'm not going to name. Sarah finally looked at him directly. There was a Marine unit pinned down by a secondary device. I disarmed the first one. I didn't get to the second one in time. Doyle went very still. That was my unit. I know. You're the tech who... He stopped, his throat working. I never saw your face. I was face down in the dirt with a corpsman on top of me. All I remember is someone screaming for everyone to get down, and then the world went white. And when I woke up in the hospital, they told me a bomb tech had absorbed most of the blast wave clearing the second device. I got lucky, Sarah said quietly. I only lost the leg. Doyle's hands were shaking now, and it wasn't from his injuries. Jonah has your picture. Not you specifically, but a photo I kept, an after-action report photo, badly cropped, mostly obscured. I used to tell him a hero saved Daddy a long time ago. He's asked to see it 100 times. Sarah's breath caught. He said, You saved my daddy in the cafeteria that first day. I thought it was just a strange thing for a kid to say. He recognized your eyes. Doyle's voice broke fully now. I don't know how. Kids notice things we've stopped letting ourselves see. Sarah pressed her palms against her scrub pants, steadying herself the way she'd trained herself to do under pressure that had nothing to do with explosives. There's more, she said. The man who built that first device 4 years ago is still out there. His name is Elias Cray. He's the one who set off the shaft explosion 3 days ago. Doyle's expression shifted from grief to something colder. The one who nearly killed my kids. He's not finished, Sarah said. ATF thinks he's trying to intimidate a witness. Me. Castle's parole hearing is coming up, and Cray wants me too afraid to testify again. Is he going to come back? I don't know, but I'm not going to let him near your children to find out. Sarah's voice hardened into something Doyle hadn't heard from her before, flat and certain, and utterly without tremor. I made your son a promise. I intend to keep it. Doyle reached across and gripped her hand, the same wrist he'd caught in the chaos 3 days earlier. Then let me help. I've led men into worse odds than this. This isn't your fight, Colonel. You saved my life once without knowing my name. His eyes held hers, steady despite everything. You don't get to carry the next one alone. Agent Ruiz set the trap 3 nights later. Using a decoy shift schedule leaked through channels Cray was known to monitor, listing Sarah as working alone in the East Wing supply annex after midnight. Sarah stood in the dim corridor, dressed in her cobalt scrubs, badge clipped where he'd expect to see it, every instinct from her old life humming under her skin like current through a wire. You don't have to do this part, Ruiz murmured through her earpiece, stationed 2 floors up with a tactical team. We can pull you and run this differently. He needs to see me, Sarah said quietly. He needs to think I'm still afraid before he makes a mistake. At 1:14 in the morning, the maintenance door at the end of the annex creaked open, and Elias Cray stepped through wearing the same gray jumpsuit, older now, harder around the eyes, carrying a duffel bag Sarah recognized by its shape alone. Agent Kessler. His voice was quieter than she remembered. I wondered how long it would take you to remember me. I remembered you 4 years ago, Elias. I just didn't know you'd survive the collapse. Cassell didn't survive it well either. Prison does things to a man's pride. Cray set the duffel down slowly, deliberately, his hands never fully leaving it. I only wanted you scared. Scared witnesses don't testify well at parole hearings. You put children in that blast radius. Collateral is collateral. His eyes flicked toward the ceiling, toward the vent Sarah knew concealed a second device, the one Ruiz's team hadn't found in the sweep. I built something better this time. No mistakes. No survivors this time, unless you walk away from Cassell's hearing quietly. You built a secondary charge in the ventilation system, Sarah said, keeping her voice level, buying seconds, feeling for the shape and rhythm of a threat she'd trained a decade to read. 12-second delay on remote trigger, probably tied to a dead man's switch in your left hand. Cray's jaw tightened, the first crack in his composure. You always were good. I'm better now. Sarah's hand moved to the radio, clipped at her hip, the signal Ruiz's team had been waiting for. Because I'm not fighting for a case file anymore. I'm fighting for 2 3-year-olds who already lost their mother. Cray's thumb moved toward the switch in his palm, and Sarah moved faster, closing the distance in 2 strides, driving her forearm into his wrist at the exact angle that had once been muscle memory, and had somehow remained muscle memory still. The switch clattered to the floor, inert, the connection broken before his thumb ever completed its motion. Cray swung wildly, catching her shoulder, and Sarah rode the blow rather than fighting it, letting her prosthetic take the brunt of the stumble, using the redirected momentum to drive him against the wall. Tactical boots thundered down the corridor as Ruiz's team breached both ends of the annex, and within seconds Cray was face down on the tile, cuffed, the fight gone out of him as quickly as it had arrived. "Device secure," a tech called from the ventilation access, wires already clipped, the 12-second delay never given the chance to matter. Sarah stood in the sudden quiet, breathing hard, her hands, for once, shaking openly, and let them. Doyle arrived 20 minutes later, having refused to stay away despite 3 separate agents telling him to, wheelchair abandoned for a cane he barely needed to use. "You're okay," he said, more statement than question, relief cracking through every syllable. "I'm okay," Sarah confirmed. 6 weeks later, Cassell's parole hearing proceeded with Sarah's testimony delivered from behind a screen, her voice steady, her identity finally, officially, no longer a secret she had to carry alone. Parole was denied. The VA offered her a new position afterward, one that hadn't existed before her file resurfaced. Staff liaison for veteran trauma response, training hospital personnel in field triage techniques normally reserved for combat medics, bridging a gap nobody had realized was there until an explosion forced the question. Vale, chastened in a way that wouldn't last but was satisfying in the moment, personally recommended her for the role, careful now to use her full rank in front of hospital administration. Jonah's ankle healed in 4 weeks. He kept the picture from his father's file on his nightstand, the badly cropped one, next to a new photo Sarah had given him, her actual face this time, smiling in uniform, the leg visible and unhidden. "You don't have to hide it anymore," Doyle told her one evening, months later, watching her walk the twins through the hospital garden without counting her steps once. "Old habits," Sarah said. "They take time." Mia ran ahead, calling back over her shoulder. "Sarah, come see the ducks." Sarah went, unhurried, unafraid, 32 steps forgotten, the prosthetic catching the afternoon light instead of hiding from it. Respect isn't given by a title, or by 2 working legs, or by a rank on a collar. It's earned in the moments nobody's watching, and sometimes recognized by the ones too young to know they're not supposed to say it out loud.